There's some period of time where it's completely impossible to have another erection, but then there's a time where it will be more difficult to have an erection. So you'll need either a more novel stimulus or a more exciting or interesting stimulus to then get an erection again.
Welcome to the Rena Malik podcast. We are glad to have you. We got another exciting AMA to do today. First things first, we want to remind you that this is not the full episode for the AMA. So if you guys are interested in hearing the whole AMA, you guys can check out renamalik.supercast.com or go to renamalikmd.com to the top of the page where it says become a premium member. And you can get access to our membership there for the full AMA. You get to ask the questions and so on and so forth. So let's get right into it. First question is from Bridget. My coworker has been going to a pelvic floor physical therapist because she was told her pelvic floor is tight. How does one check if their pelvic floor is tight?
Bridget, what a great question. So let's start off with what is a pelvic floor. So a pelvic floor is a bowl of muscles that sits in our pelvis that holds up all our organs, particularly the bladder, the rectum, and for women, the uterus. And it is present in both men and women, and both men and women can develop a high tone pelvic floor or pelvic floor dysfunction. And why this happens is because sometimes people carry stress or anxiety in their pelvic floor. So just like people get TMJ or they clench their jaw at night and they wake up with headaches, that's often due to stress or anxiety or being a type A personality. And similarly, your pelvic floor can tighten up and tense. And also, if you have certain hip abnormalities, so say you have a labral tear or you have a back injury that's now putting things out of alignment, that can affect the ability of your pelvic floor to function normally. Also, if you've had long-term kind of bad behaviors like holding your urine for too long or not having regular bowel movements or being constipated for long periods of time because you've been holding your stool, that can then present as pelvic floor dysfunction as well. So when you have pelvic floor tension, I describe it as if you were lifting on your bicep, right? And your bicep got stuck like this with your arm in the air. And you started then, so slowly feeling pain here in the muscle itself, but also in the elbow, in the shoulder, in the back, maybe even in the wrist, right? Similarly, when you have pelvic floor problems, particularly with high tension in the pelvic floor, you'll find that you may have troubles with a variety of different things. And it can vary from person to person. Some people will experience urinary urgency, like gotta go, or going more often to the bathroom. Some people will experience constipation. Some people will experience back pain. And for men, sometimes they'll experience pain with ejaculation or with erections. Women can have pain with sex or feel like they constantly have recurrent urinary tract infections. And so ultimately, it can present in a variety of different ways. And how can you assess your own pelvic floor? Well, that's a little bit challenging because it requires an examination. And so typically, we recommend getting evaluated by a certified professional who understands the pelvic floor. Now, that could be a urologist, that can be a gynecologist, that can be a pelvic floor physical therapist who can assess your pelvic floor and determine if those muscles are indeed tense. And then if they are, the treatment, at least the first line treatment, is going to pelvic floor physical therapy to learn how to relax those muscles. And we have an episode coming up in the future featuring a pelvic floor physical therapist. We're going to talk all about what kinds of exercises you can do at home and what to expect when you see a pelvic floor physical therapist. So keep an eye out for that one.
I like it. Get ready for those exercises. So I also want to remind our listeners and viewers that we do get a lot of question ideas from our social media. So we do look at the comments. We do look at the YouTube comments. If there are questions that are asked repeatedly, we try to tend to group those into one question, or we try to look through the many questions that we get sent to us on all the platforms. So please do continue to comment. That really does spark a lot of good questions for us to choose from. So the next question, no name, but it says, what should I do If I notice some blood in my sperm load, is it serious?
Yeah, that's a great question. That can be very, very frightening, right? Think about having an ejaculation and seeing blood in there, right? But fortunately, the majority of this time, this is not a dangerous thing. It is not a sign of cancer. It is not a sign that something is abnormal or wrong. Essentially, if it happens once in a while and you're otherwise feeling fine, you don't need to do anything about it. If you seem to have repeated blood in the sperm, then it may be valuable to see a urologist and get ruled out for anything more dangerous. So that could be getting a PSA or a blood test for prostate cancer, or getting an ultrasound to see if there's any blockage in the ducts that carry semen out through the urethra. And so those are kind of the most common causes. But I will say that cancer presenting as blood in the sperm is exceedingly rare. And so rest assured that if you have blood in the sperm, this is not something you need to worry about or stress about. If it becomes a repeated issue, then absolutely get evaluated.
Right on, right on. Got to check the plumbing every now and then, guys. All right. I had a circumcision at birth, but want to regrow my foreskin. What's the best advice to do this? This is coming from Rodney from your old stomping grounds in Maryland.
All right, Rodney. So circumcisions are often done at birth, and sometimes people do have the desire to regrow their foreskin because they want that appearance, or they may feel like it would complete them in some way. And that's completely normal and fine if you feel that way. I would say that there are a variety of things that people have done over the years to try and regrow foreskin. However, nothing has been really, really remarkable. So there are certain types of taping that can be done, where you use certain types of tape to actually kind of pull on the foreskin and add a little bit of traction. And over time, with some dedicated traction, you can actually find that you may regrow some length on the foreskin. And so basically, it's just constant stretching of that area. Now, it doesn't look the same as normal foreskin would, because it's actually, just getting fully stretched, completely stretched out. Whereas, typically foreskin isn't all sort of floppy, I guess, so to say. And so ultimately there's that option. There have been some surgeries that have been discussed in terms of like taking a skin graft and surgically adding skin to the penile tissue and to the foreskin to make it appear longer. However, the outcomes are not really that desirable because the skin never looks exactly the same as foreskin. Sometimes it contracts down. And so it's not something that we typically do because it doesn't really give you the result you're looking for. So ultimately, there are sort of options for taping. There's options for things that try to expand the foreskin. And so you can look online to find those if you're really curious and see if that's something that you want to do. But realize that it is sort of a commitment in doing this for, a significant amount of time daily for months before you see a difference.
Okay, good. At least there's some ideas out there. All right. The next question from New Hampshire. KMJ asks, what's the least amount of time before I can have another orgasm after having had an orgasm?
Yeah, that's a great question.
Yeah.
So that's called the refractory period. And so every person, and more commonly in men than women, have what's called a refractory period. And so what that is a point in time where after you ejaculate, you cannot actually have another ejaculation or even initiate intercourse. You cannot really get an erection again. And that's because essentially it's sort of like your body releases a ton of a hormone called prolactin. And that was originally thought to be the cause of this, that when you had this high level of prolactin, it would inhibit dopamine, which is essentially the hormone that tells you that's sort of a pro-erectogenic hormone. And so while that's not as cut and dry as it's not just a prolactin issue, it's more complex than that. Ultimately, there is sort of a protective mechanism that your body has to prevent you from being able to have another erection very soon. And the reason for this is there's some theories behind it, which are sort of interesting. So one is they want to avoid exhaustion, right? Because if you were able to have intercourse nonstop, then potentially it would put men at risk for exhaustion. And so that's one theory. The other theory is that when you ejaculate into a female for the purposes of reproduction, if you then were to go back and have sex again, you might displace that semen that that you just ejaculated, which would then defeat the purpose of trying to have a child. And so those are sort of the two ideas as to why this happens. And interestingly, when you're younger, this refractory period is much shorter, but as you age, this refractory period can get longer with time. And often it can even be as long as a full day for some people. And so that is unfortunately sort of associated with aging. And at this time, we don't have anything that exactly causes you to reduce that refractory period. There are some thoughts of like trying to avoid ejaculation and orgasming without ejaculation to allow you to have multiple orgasms. However, there's no real scientific data behind that, although some people report that that's possible. And ultimately, this refractory period has an absolute refractory period and a relative refractory period. What that means is that there's some period of time where it's completely impossible to have another erection, but then there's a time where it will be more difficult to have an erection. So you'll need either a more novel stimulus or a more exciting or interesting stimulus to then get an erection again. And so that's sort of neither here nor there, but just something interesting for you guys to know.
Right on. Refractory period. You learn something new. I think you did a video on that one.
I did.
Right?
Yeah,
right?
I did.
Yeah. So guys, definitely look for that on the channel. Next question is from CR from Vegas. CR asks, I had one of my girlfriends say she got her vagina steamed to remove toxins from her body. She asked me to go with her, but I'm scared of anything hot near my vagina. Is steaming the vagina helpful?
All right. This is a good
Steamy
question.
vagina.
So all of these questions actually have videos. So we'll try to link all the videos in the description. So if you want to watch full videos on these topics, I'd be happy to link them. But vaginal steaming, it comes from sort of ancient practices where they thought that like you would cleanse yourself by sitting on steam and letting that steam come into the vagina and like clean menstrual blood and things like that, or clean the uterus. But ultimately, nothing's going in the uterus from the vagina. The cervix is not open in women, and so it's not just going to go in there and clean things out. And two, you don't have toxins in your body. Your body does that for you, right? So every month a woman menstruates and she gets rid of the lining that has grown over that course of that month if she doesn't get pregnant. So that's one way your body cleans. But two, your vagina is a self-cleaning oven, and so it will sort of clean itself and regulate a normal microbiome that keeps it healthy. And so, there's lubrication, there's other things that are constantly happening to keep the vagina clean. And so ultimately steaming is probably dangerous in a lot of cases because when it's hot, you could burn yourself, and there definitely have been reports of burning. And two, you're putting this sort of not normal pH fluid and steam into the vagina, which can then disrupt the normal homeostatic balance. So it could put you at higher risk for yeast infections or recurrent UTIs. And so ultimately, I don't recommend steaming. If you're worried about an odor or something else, see your gynecologist and assess if there's a genital infection, or just, drink more fluids and see if that clears it up, because oftentimes it's just related to what you're eating or drinking.
Got a bunch of questions from the subscribers on the Supercast. So let's get into a lot of these fan member questions. What is the typical process that would happen in a urology examination? And would you, Dr. Malik, ever show what you do in a future video?
Yeah. Well, let's start with what you can expect in an examination. All exams start with, us talking. So we talk about what's going on with you. We'll generally ask about, there's sort of three categories I always ask about. So urination, if you're having trouble urinating or you're having leakage or other symptoms related to urination. I always ask about constipation as well, because oftentimes that's related. And I ask about neurologic injuries, and then I ask about sexual function. So that's obviously related to the things I do, particularly as a urologist. But if you're seeing someone for prostate cancer or for kidney stones, they're going to ask, similar questions, but they may ask more about diet, or they may ask about blood in the urine or other things like that. So ultimately, we ask questions about what's relevant to the issue that you're there for. And we want to know about your history. So what other medical problems you have, what other surgeries you've had. And it's important to tell us all those things, because sometimes you may not realize, but there's a link with something you have. For example, thyroid disease is linked with sexual dysfunction. So if your thyroid's not working correctly, it may be affecting your sexual function. And so ultimately, there's a reason that we do all these things, right? We want to make sure your medications you're taking taking are not affecting your body in any way that might be negative, if in terms of sexual function or urination. So we ask all these things, and then we go ahead and do a physical exam. I think the important thing is we will only do what you're comfortable with. So we always ask permission. If you want a chaperone in the room, a chaperone can be there, and we do the examination, which would include a genital exam, but it may not. So we will always examine the abdomen, the flank where the kidneys are. We may do a little neurologic exam, making sure that your sensation is intact and certain things like that might be relevant to your issue, not always. And then we would do a genital exam. So for men, that exam means that we're going to take a look at the penile shaft and look at the testicles and the areas around it, make sure we don't see any abnormal lesions or bumps or lumps or anything like that. We'll assess what the urethra looks like, the opening. Does it look normal? We'll assess the size of the testicles as well as the cords, where we might see some signs of like varicoceles or other abnormalities that would tell us if there's anything wrong there. And we may also assess the lymph nodes in that area if you're there for a cancer reason. And then we would do a prostate exam. Now, as a urologist, I think a prostate exam is very, very useful because it often gives us a lot of information about how big your prostate is, if that might be causing issues with urination or might be causing other symptoms you're having. And then also it tells us if we feel anything abnormal that might be concerning for cancer. Now, if you're just there for screening of cancer, people will argue that you probably don't need a prostate exam because the PSA will detect the large majority of prostate cancers. But there are a small subset of cancers that don't secrete a PSA. And so that's why I still think you should do one. But again, the decision is always yours. You should always feel comfortable to say, no, thank you. I don't want to have this exam. And I'd rather wait for another day or not have it at all. For a female exam, it is a pelvic exam, and it is not just like the gynecologist. So when we do our exam, we're not looking for the cervix to do a pap smear. We're looking at a whole variety of things. So I tend to, give my patients a mirror so they can actually watch while I do the exam and see and learn their anatomy. So we'll go through all the anatomy. We'll say, we'll make sure things both in the vulva and the vagina don't hurt while we're doing the examination. We'll assess the vestibule, which is the outer part right before the vagina that's very hormonally sensitive. So we'll assess that if there's any abnormalities or tenderness there. We'll look at the vaginal tissues and we'll actually feel those pelvic floor muscles in the vagina to assess for tension or pain or tenderness. And we may then assess for prolapse. So we might use a speculum. Typically, we'll just use one side of the speculum to assess if there's any prolapse or herniation of the vaginal tissues, and as well as see if there's any abnormalities like diverticulum or cysts or other abnormalities that may be going on. But ultimately, it's important to do these exams. We get a lot of information that would help us determine if there's any other issues that might be causing some of your symptoms. And so that's sort of the entirety of the exam. And then usually you get dressed, and at least in my office, I have everyone get dressed and we talk while you're fully clothed so we can have a conversation while you're comfortable. And then we just talk about what we've sort of gone through, what we found during the exam, my thoughts on what your diagnosis might be, and what our next steps are in terms of getting you better. And always throughout this whole experience, what I want to know is what your goals are and how we can reach them and what you can expect. So say we try this new treatment, is it going to work? When are we going to touch base again? How are we going to know if it's working, and so on and so forth? And what is the next step if it doesn't work? Because certainly this is personalized, right? Every person is individual, and what works for one may not work for another.
All right. It sounds like every individual's got probably a different exam or a different scenario play out depending on what's going on.
If you guys are enjoying this AMA, make sure to check out our membership at rinamalik.supercast.com, where you can become a premium member, ask your questions there, and you guys get first dibs on having your questions asked here on the AMA. And we want to be able to answer everyone's questions, but clearly it's not feasible all the time, and this allows you to get that opportunity. And we greatly appreciate you. So if you've enjoyed it, check out the membership, and as always, we're going to take care of yourself because you're worth it.